أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. وصلي وسلم على أشرف خلق الله محمد بن عبد الله وعلى آله وصحبه وسلم. السلام عليكم ورحمة الله. Our presentation today, inshallah, will be about imaging of the skull and brain. The radiological methods and investigation that we perform to assess the skull and brain include plain X-rays, CT scan, MRI, ultrasound, angiography, radioisotopes study. And inshallah, during this session, I'm going to talk about all this modality and its role in assessment to this part, and also I will going to explain the radiologic anatomy of brain and skull on CT scan and MRI mainly. Start with skull X-ray, which is not commonly performed for assessment of the brain and skull, and it may be used if CT is not available to assess the skull, especially in case of skull fracture. But if the CT is available, you have to do CT, especially CT bone window. But if it is not available, no way. It is the next option, X-ray for the skull. But skull fracture may be difficult to be identified by the skull X-ray. And also this plain X-ray cannot be used for evaluation of intracranial injuries or the brain damage. So skull X-ray is not used if it is not used for the assessment of skull fracture if the CT is available. This is skull X-ray frontal view. You can see the calvareal bone, and you can see the orbit, the sinuses, moist sinus, the nasal turbinate, you can see the suture, lambdoid suture, and sagittal suture. This is plain X-ray of an adult. And this is also skull X-ray or skull radiograph in demonstrates this, fracture. This is fracture, cranial vault fracture, seen as linear density. This is a fracture. It is perpendicular to the sagittal suture. So this is X-ray demonstrates how the fracture appear, which appear as a radiolucent line. X-ray for the skull X-ray, lateral view. Also, you can see the calvareal bone, the frontal sinuses, the mandible, and you can see the sphenoid, the hypophyseal fossa or sphenoid fossa, the sella turcica, and the spine cervical spine. So this X-ray for the skull is not used or performed for assessment of the skull and brain pathologies. But if the CT is not available, no way you can do it for assessment of the fracture. This is skull X-ray for the child before closure of the anterior fontanelle. This is anterior fontanelle. This is, and also you can see the lambdoid suture and sagittal suture and the orbit on both sides. This is the fontanelle, anterior fontanelle. Please look to this fontanelle because it is used for ultrasound, cranial ultrasound in neonate. Before closure of this fontanelle, we can use this anterior fontanelle to put the probe in this area to evaluate the brain. So this technique done before closure of this anterior fontanelle. This is anterior fontanelle. Also, there is a specific X-ray for assessment of the paranasal sinuses. Paranasal sinuses can be assessed by plain X-ray with certain view. ما بنعمل السكال فيو المعروفة دي frontal and lateral. In the specific views for اسمها paranasal sinuses, there are many paranasal sinuses view اسمها كثيرة يعني لكن المهم done for for assessment of the paranasal sinuses. As you know, the sinuses, paranasal sinuses containing air. Paranasal sinuses دي مثلا maxillary sinuses, sigmoid sinuses, sphenoid sinuses, frontal sinuses, all these sinuses contain air. So on the plain X-ray, the sinuses appear as translucent or transradiant black because it contains air. These sinuses, as it contains air, it appears as translucent or transradiant on plain X-ray. Plain X-ray also can illustrate the mucosal thickening. يعني مثلا هنا الميوكوزا is thick, mucosa is thick. This is the evidence of of sinusitis. And also plain X-ray can be used for demonstration other signs of sinusitis or sinus disease, which is fluid level. This is fluid level. You can see there is a straight line. There is a surface straight line separating between the two densities. This is fluid level. And here there is a mucosal thickening. But in most sinus disease, CT is preferred technique. This is a CT frontal demonstrate the sinuses. This is the right maxillary sinuses or antrum, and this is the left maxillary sinus, and this is the sigmoid. So CT is the best imaging technique for assessment of the sinuses, paranasal sinuses disease. MRI also can be used for assessment of these sinuses, but it is not required frequently, or it's not required as a primary investigation. That is, if CT is available and there is a strong indication for highly suspicious case of paranasal sinuses, CT is preferred because many cases of paranasal sinuses cannot be illustrated by paranasal sinuses X-ray. Now we're going to talk about CT. CT عارفين البيشنت بيكون supine with head first. This is a CT gantry. The patient lie on this table. Then we push this patient toward this hole with his head first, not feet first, head first. Then this CT can show the anatomy of the skull in transverse section. يعني CT أصلا هي بتعمل لنا section transverse section cross sectional anatomy illustrate the anatomy. فدي بيسموها السكانوجرام or scout view illustrate the level of the section. يعني احنا بنعمل section from the base of the skull up to the vertex to cover all this area. Section at this level, then until next one till we cover all this area. This is a technique of CT. So CT, the patient before performing CT, the patient should be fasting for 4 to 6 hours, especially if the patient may receive contrast, or the patient may also may be sedated. So in case of sedation and contrast, the patient should be fasting for 4 to 6 hours. 4 for the adult, for the children, and 6 for the adult. And as we explained, the patient should be supine with head first. Then we take a scanning from the base of the skull up to the vertex. The technician select the area of interest. مثلا زي دي select the area of interest, this area, and then take a slice. The routine slice thickness of the brain about 10 millimeter. يعني thickness of any slice بنعمل 10 ملم سلايس 10 ملم سلايس 10 ملم سلايس till we cover this area. For the pituitary, if we are interested in the pituitary area, we take a thin slice thickness, usually about 5 ملم. لأن المنطقة صغيرة فبنعمل 5 ملم slice thickness to to scan the area of the pituitary gland. فذيس السي تي زي ما قلنا هي axial سيدية، لكن can be reconstructed من عملية إعادة تركيب or reformatted into other planes such as sagittal and coronal. لكن هي from the start CT is axial section. This is CT axial and this is sagittal, reformatted sagittal, and can also be reformatted or reconstructed into coronal plane. نيجي بعدين نتكلم عن الترمينولوجيز، اديناكم لها تقييم في البلوك ونمشي عليها سريع. سي تي ترمينولوجيز، اول شيء عندنا حاجه اسمها نون انهانس سي تي. لما نقول نون انهانس سي تي معناته انه البيشنت not receive contrast or CT without contrast IV contrast. فوين the patient is scanned without receiving any contrast نسميها non enhanced CT. non enhanced CT. the area that appear less dense بنسميها hypodense يعني بتكون black, and the area appear more dense bright يعني بتكون نسميها hyper dense, and the equal density يعني المنطقة إذا كانت of equal density to the surrounding area بنسميها isodense of similar density. According to this, how to describe this area? Yes, anybody here?
Hyperdense.
Hypodense, because it is less dense. Hypodense. How to describe this?
Hyperdense.
So hyperdense is area of more density than the other normal tissue, but this is a hypodense. To, to, to explain the isodense areas, زي ما قلنا isodense means of similar density. Do you see any abnormality in the right side hemisphere? Do you see any abnormality?
Isodense.
Yes, it is isodense. Why do you not why you are not see this lesion؟ لأنها isodense. ليش؟ لكن إذا هي isodense ما is never to be seen. Why؟ بالمنطق كده لأنه هي الدنسيتي بتاعتها similar to the normal brain tissue، لذلك ما مبينة. لكن إذا كانت increase or decrease بتكون مبينة compared to the normal brain tissue. لكن the isodense lesion is similar to the brain tissue, so it is not seen. But we identify there is a lesion here by this compression. لاحظ إنه this right ventricle normally should be on the right side and this is the left one, but the right ventricle is compressed and shifted to the other side. طبعا معناتها في شيء pushing this ventricle to the other side. فإذا there is a lesion here, but still we are not able to see it because it is of similar density to the brain tissue. فالمنطقة دي فيها lesion لكن ما مبينة. ليش؟ لأنها of the similar density to the brain normal brain parenchyma. لكن عرفنا الهنت for this lesion is presence of mass effect اللي هي shifting of the midline and compression of the right ventricle. طيب السي تي نمبر اتكلمنا عنها برضه في الانترودكشن، فقلنا ان النورمال برين بارينكيما كانت range between 30 to 40 Hounsfield unit or CT number. If the CT number كانت more than 40 معناتها هتبقى hyperdense area. If the CT number or any lesion or any area appear كانت الهايبوسفير unit بتاعتها less than 30 اكيد هتبقى شنو hypodense. So any area below the 30 Hounsfield unit appear hypodense. مثلا عندنا CSF ranging between 0 to 15 brain edema or infarction assist according to content إذا كانت فيها fluid or blood or fat, or an air. All these tissues and structure appear hypodense. ليش؟ لأنه لاحظوا الهاوس فيل يونت or the CT number less than 30، لذلك هي حتكون أقل من 30 ف it appear black or hypodense. In contrast, any areas appear برايد اكيد حتكون الهاوسفيل يونت اكثر من 40، فلذلك حتكون لنا appear hyperdense. بنقول hyperdense for the CT terminology describe for description of any bright area بنقول hyperdense. فاذا شنو recent blood هاوسفيل يونت بتاعته range between 60 to 90 هاوسفيل يونت above 40 يعني، فلذلك appear hyperdense. calcification very dense بيكون more than 100. many tumors and proteinous fluid all these are appear hyperdense. فاذا عشان انت تفهم السلايد دي بس تعرف انه شنو المهم عندنا انه hyperdense معناتها شنو appear bright and hypodense appear black. This is a terminology for the CT appearance of any area. فاي areas normal or abnormal Hounsfield unit before 30 in this CT or the CT head بتكون لنا شنو appear hypodense, and any area of Hounsfield unit more than 40 appear bright, and we call it hyperdense. According to this is a CT color CT head. How to describe this area according to the CT terminology. هنقول ايش to describe this area according to the terms that have been explained just now. This
Hyperdense.
yes, hyperdense. This is a hyperdense. How to describe this area? This
hypodense.
hypodense. ليش؟ لأن تقارينه مع النورمال brain.
Normal.
Yes, is black, so it is blacker than the normal brain tissue. So this is hypodense, and this is a hyperdense compared to the normal brain parenchyma. How to describe this?
Hyperdense.
Hyperdense also, and this
Hyperdense.
hypodense, and this
Hypodense.
hypodense, and this one.
Hypodense.
So any black area compared to the
Isodense.
isodense ما بتشاف خالص. isodense بتكون of similar density حتى ما بتكون مبينة لك. So this is blacker than the other normal brain tissue. Compare between this area and this area. This area appear more darker. So this is hypodense compared to the other brain tissue. And how to describe this lesion at this area?
هذا isodense.
This is isodense, yes. يعني الانتي ليجن هنا احنا ما شايفينها لانها isodense, but the hint or the clue for this is shifting of the midline structure اللي هي right ventricle and compression of the right ventricle and effacement of the sulci. يعني ايش effacement of the sulci? If you look to the other side, there is a sulci. This sulci containing CSF, but in this area there is no sulci. حصل لها مسح. Effaced is مسحت due to presence of of lesion here. So this نسميها mass effect. Mass effect means انه there is a عندنا sign of mass effect. اذا كان عندنا effacement of the cortical sulci يعني there is no cortical sulci مثلا this area means انه there is a mass effect. Or if there is a compression of the ventricle, this ventricle is compressed and other sign is shifting of the midline structure. فهي عندها شنو range. ممكن just effacement of the cortical sulci اذا كانت اللينيا الصغيره او compression of the ventricle زي الفنتريكل ده compressed او shifting. لاحظوا كان ده الميد لاين حصل shifting for the right ventricle to the other. بيقوا عندنا two body of lateral ventricle in the left لانه ده هو shift is the right one. but this is the midline. This is the midline. لكن حصل لنا shifting of the right ventricle from the midline to the other side. فدي بنسميها the term for this يعني disappearance become massive effect. يعني اي واحده من دول بيسميهم massive effect. ممكن تلقاهم اثنين ثلاثه، لكن any one of these called massive effect. طيب احنا اتفقنا انه سي تي ممكن تكون سي تي with contrast or سي تي without contrast. اذا اعطينا البيشنت contrast وصورناه بنسميه سي تي with contrast. If we did this CT without contrast, يعني ما اعطينا البيشنت contrast and we push him directly to the CT machine without any contrast بنسميها non-enhanced CT. مثلا non-enhanced CT for brain. طبعا الان بنتكلم عن البرين، لكن الكلام ده بينطبق على كل الجسم abdomen or any other part. طيب بيحصل ايش؟ احنا اعطينا البيشنت contrast. if there is no lesion يعني كانت normal scan، خلاص انت هتشوف الكونتراست ده in the normal areas. يعني ممكن يكون في الكدنيز مثلا، في البلاد فيزلز، في النورمال enhancing area يعني. if there is a tumor or lesion, any lesion, some lesion may take the contrast. تعمل الكونتراست شنو؟ uptaking. دي بنسميها enhanced lesion. لاحظوا انه سميناها enhanced lesion. الآن بنتكلم عن الليجن itself not عن التكنيك on CT. enhanced lesion if the lesion takes the contrast, uptake the contrast or taking the contrast بنسميها enhanced lesion. وإذا كانت السي تي عملناها with contrast بنسميها enhanced CT. there is a difference between enhanced lesion and enhanced CT. enhanced CT with contrast. enhanced lesion when the lesion itself uptakes the contrast. طيب لما الليجن دي when the lesion uptakes the contrast عندنا many pattern of enhancement. ممكن كل الليجن تاخد الكونتراست بنسميها homogeneous enhancements with different with the equal شنو pattern بنسميها homogeneous enhancement. احيانا بيحصل لنا heterogeneous يعني some part of the lesion taking the contrast and the other not or not بنسميها heterogeneous enhancement. The other is called ring enhancement. ring يعني peripheral or marginal enhancement. نلقى الكونتراست around the lesion in the periphery of the lesion. And the last one is serpiginous enhancement. Serpiginous enhancement occurring when only one condition, arteriovenous malformation. But in the other three, there are many differential diagnoses. Inshallah, we are going to talk about some of these. لكن serpiginous enhancement like this is serpiginous enhancement occurs only in the arteriovenous malformation. يعني لما نشوف enhancement better like this بنعرف انه there is arteriovenous malformation in this area. زي ما قلنا عندنا homogeneous enhancement يعني كل الليجن تاخد الكونتراست زي دي. this is homogeneous enhancement. heterogeneous enhancement like this يعني لاحظ انه الليجن في some part taking the contrast patchy enhancement. اسمه patchy enhancement or heterogeneous enhancement. and this is the ring or marginal or peripheral enhancement. الليجن هنا موجودة كل دي الليجن لكن حصل enhancement in the periphery بسموها ring or peripheral or marginal enhancement. فزعنا انه this is a pattern of enhancement of the lesion. طيب نتكلم شويه عن السي تي اناتومي. احنا زي ما قلنا بنبدا الاسكان من الفيرتكس من ال base of the skull ناخذ section till we reach the vertex. But this is a CT starting from the base of the skull and then we go up to cover all the area. لاحظوا الاناتومي differ from area to the area according to the level of the section الكروس section. هي CT برضه of the other levels. لاحظوا انه with contrast. عرفنا with contrast كيف كل الابيض دي contrast. This is a CT with contrast. This is CT with contrast of different level. الاناتومي هنجي نتكلم عنه لكن لاحظ انه الاناتومي differ according to the level of the section. الان هنتكلم شويه عن الاناتومي of the ventricular system. عارفين السي CSF cerebrospinal fluid produced in the ventricle by the choroid plexus in the fourth ventricle, lateral ventricles, and third ventricle. عندنا حاجة اسمها choroid plexus which is responsible for production of CSF. The CSF passing from the lateral ventricle to the third ventricle through the foramina. Then from the يعني لاحظ انه من fourth ventricle to the third ventricle. Then from the third ventricle to the fourth ventricle through the aqueduct and from the fourth to the three the interventricular foramen of mono. This is the interventricular foramen of mono from the lateral to the third, then from the third to the fourth through the sylvius aqueduct. طبعا تابع ده بنمشي للسبرخنويد سبيس. فاذا حصل لنا obstruction anywhere لان هنيجي نتكلم عن هيدروكيفالس، هيحصل لنا هيدروكيفالس اللي هو dilatation of the third ventricle. احنا اذا عملنا section at this level cross section at this level، لما اذا عملنا سي تي the section that pass through this level هيحصل لنا شنو؟ الفرونتال هورن وشنو؟ والاكزيبيتال هورن. This is frontal horn and this is occipital horn and this is the body and this is the body and this is the temporal horns. عندنا frontal, occipital and temporal horns. This is the body of the ventricle. فإذا عملنا section passing from on this level هيحصل لنا شنو؟ الانتيريور horn or frontal horn anteriorly and the occipital horn posteriorly. لأن الليفل of the section pass through this area. إذا عملنا section above، لاحظ إنه above the horns معناتها at the level of the شنو؟ of the body of the ventricle lateral ventricle. طبعا عندنا two lateral ventricle, one on the right and the other on the left. But this is the body of the left ventricle and this is the body of the right ventricle. So the ventricles appear according to the شنو؟ level of the section. نتكلم شوية عن basal ganglia anatomy. Also زي ما كنا قلنا this and the anterior horn of the lateral horn, this left anterior horn of the lateral ventricle and this is the right one. Here عندنا the caudate nucleus, head of the caudate nucleus, and this is the internal capsule. And what is this type? What is this? Anyone?
I think thalamus.
Thalamus is lateral to the third ventricle. The area of thalamus, you have two thalami. This is the third ventricle. Thalamus.
هذا اللينتيفور ممكن.
This is the lentiform nucleus. So this is the lentiform nucleus. So look to the internal capsule. Internal capsule separating between the head of the caudate nucleus and lentiform nucleus. And also this is the internal capsule. طبعا عندنا anterior limb and posterior limb. Also separating between the lentiform nucleus and the thalamus. So this is the thalamus. And we have a two thalami lateral to the third ventricle. This is the third ventricle. So this is the left thalamus and this is the right thalamus. This is the head of the caudate nucleus and this is the lentiform nucleus. This is the anterior limb of the internal capsule and this is the posterior limb, anterior horn of the lateral ventricle, left one, and this is the anterior or frontal horn of the lateral ventricle. This is MRI and this CT. أهم شيء you have to differentiate between CT and MRI. زي ما قلنا you have to look to the bone and the soft tissue also. The soft tissue is يعني MRI is superior in demonstration of soft tissue. تلقى more details compared to CT. وأهم من دي السكال بون. السكال بون بيكون very dense أبيض مرة فاقع اللون يسر الناظرين. لكن هنا البون ما تقولوا زي البون. البون here it is the bone which appear dark of no signal. This is bone. لكن الأبيض دي شنو؟ fat, subcutaneous fat. This is the subcutaneous fat. So the bone is here. Bone is here. But this is CT and this is MRI T1 نفس الاناتومي تكلمنا عنه CT. Also the head of the caudate nucleus, lentiform nucleus, this thalami, third ventricle, anterior horn of the lateral ventricle. CT vascular anatomy عارفين عندنا circle of Wills. circle of Wills بعد ما عندنا two vertebral arteries joined together to form the basilar artery. وعارفين الانترنال carotid artery يدينا شنو؟ anterior cerebral artery. This is anterior cerebral artery and anterior cerebral artery. The anterior cerebral artery connected by anterior communicating artery. Like this small vessel connecting between the two anterior cerebral artery. And the basilar artery بيدينا شنو؟ posterior cerebral artery. The posterior cerebral artery connected to the internal carotid artery or middle cerebral artery by the posterior communicating artery. So this is posterior communicating artery. أما دي middle cerebral artery which is the largest branch from the internal carotid artery. Again, this internal carotid artery بيعطينا middle cerebral artery and middle cerebral artery. Also internal carotid artery give us anterior cerebral artery on both sides, anterior cerebral artery, which connected by the anterior communicating artery. The basilar artery gives posterior cerebral artery. عشان تكمل السيركل they should be connected by the posterior cerebral artery. إذا عندنا كده دي السيركل of Wills كملت. MRI زي ما عرفنا هي use strong magnetic field، يعني مغناطيس كبير جدا، يعني 3 or 5 تسلا، يعني very strong magnetic field. وعندنا معاه راديو فريكونسي كويل زي ما اتكلمنا عنها في الانترودكشن. اهم شيء في الام ار اي نحن نعرف انها مالتي بلانر ايميجينج. يعني شنو؟ يعني السي تي زي ما قلنا هي اكزيال، لكن بنعمل لها ريكونستراكشن من فروم ذا ستارت. سي تي اكزيال كلها بتحكينا اكزيال كاتس، لكن ممكن نعمل ريكونستراكشن. لكن ام ار اي فروم ذا ستارت بتعطينا شنو؟ اكزيال بلين اند سيجيتال بلين اند كرونال بلين. on MRI any MRI عندنا حاجه اسمها sequences اتكلمنا عنها on the introduction also. MRI in any MRI tech protocol for any part should include T1 and T2. CT1 and T2 should be included in any MRI anywhere for the skull, from the head, for the knee, for any T1 and T2 should be included in any protocol. This is sagittal T1 MRI brain. Why this is sagittal T1? Why not T2? And this is T2. How to differentiate between T1 and T2? Yes.
عشان السي اس اف ممكن.
Yes. CSF. How CSF appear in T1?
تي 1 راح تكون هايبو.
Hypo. Yes. Thank you. Hypo intense. This is CSF in the first ventricle or CSF in the lateral ventricle. In the T2, CSF appears, hyper intense. So this is the difference between T1 and the terminology for the MRI. At the dark area on MRI بنسميها hypo intense. بتكون the low signal or hypo intense بتكون dark. اما الاريا برايت بنسميها hyper intense or بنسميها of high signal. The area in between الايزو intense بتكون of similar intensity، بتكون of intermediate signal. زي ما اتكلمنا قبل شويه انه السي اس اف بيكون شنو on T1 بيكون black، and CSF in T2 بيكون برايت اللي هو hyper intense. دي بنعرف بيها دايما ان this which sequence is this. You have to look to the CSF. If it is black نعرف انه this is T1 sequence. If it is bright this is a T2. طيب زي ما قلنا في السي تي ممكن نعمل سي تي with contrast او سي تي without contrast. Also an MRI can be done without contrast. نعمل تصوير من غير ما نعطي البيشنت any contrast. But we can give the patient contrast. Contrast for MRI زي ما اتفقنا المره اللي فاتت اسمه gadolinium DTBA. Why we give this contrast for the patient؟ ليش؟ فائدة ايش؟ What is the value for this contrast؟ أول شيء to differentiate between the lesion space occupied lesion. يعني احنا هنعرف إنه مثلا ممكن نلقى لنا tumors أو نلقى لنا المهم lesion. Is it abscess? Is it glioma? Is it meningioma? Is it arteriovenous malformation? What is it? But this contrast enhancement of the lesion help us in differentiation between the lesion. لأنه عندنا better of enhancement هنعرف إنه which يعني what is the differential diagnosis for each better of enhancement. إذا help us in differentiation between space occupied lesion, and also can be used for assessment of activity of some lesion. multiple sclerosis إذا كانت الليجن not enhancing with contrast بنعرف إنه this is non-active plaque. لكن if it is takes the contrast بنعرفها إنه is inactive phase. This is also so this gadolinium DTBA MRI بتساعدنا في شنو؟ في for assessment of activity of some lesion. طيب احنا زي ما طبعا انها هي T1 with الكونتراست بنعطيهم T1. يعني عندنا صوره اسمها T1 with contrast لكن ما عندنا T2 or other. فالكونتراست given with T1. فده نعمل comparison between T1 with contrast and T1 without contrast عشان نعرف انه the better of enhancement. Also this gadolinium DTBA can be given to the patient يعني the other indication for gadolinium DTBA is assessment of the postoperative tumor recurrence. يعني اذا بيت مثلا البيشنت عندها مننجيوما عملنا لها operation ف to assess انه حصل recurrence لازم نعمل شنو سي MRI with contrast. يعني لابد ان to do شنو MRI with contrast for assessment of the recurrence of the tumor. طيب this is MRI and this is MRI. What is the sequence in this one? Or what is the technique يعني ايش this is MRI ايش T1 or T2?
تيون
T1 and this one
برضه تيون.
what is the difference between the both?
في هنا ليجن يمكن هايبودنس وهنا هايبردنس
Why this
ولا
one?
كونتراست أو
Yes,
كونتراست.
thank you. This patient دي قبل الكونتراست this is after contrast. لاحظ الليجن uptakes the contrast أخذت الكونتراست ف this is the same patient عملناها قبل الكونتراست and after the contrast. ف this is MRI T1 without contrast and this is MRI T1 also. لابد إنه contrast لازم يكون مع T1 with contrast. بعد ذاك بنجي نشوف انه والله الليجن هي enhancing والبتر ونعرف انها what is the definition and what is the final diagnosis. زي ما اتكلمنا عن البروتوكول اوف ام ار اي انه برضه من الاسكان بيبدا من البيز اوف ذا skull till we reach the شنو the vertex and we go to take an axial cut to cover all the anatomy. لاحظ anatomy there is يعني different anatomy in different levels. يعني مثلا هنا في الفنتريكلز هنا البيزل جانجليا مثلا هنا في البرين ستيم according to this section. this is axial MRI لكن زي ما اتفقنا انه هي مالتي بلانر also بنعمل منها sagittal. this is start from the مثلا left side sagittal لحد ما نصل mid sagittal and to other side. start from the left to the right to cover all area in sagittal section. طبعا كذلك بنعمل كرونال. الان ما عندنا كرونال. طيب on MRI يعني مهم تعرف السيجنال في كل النورمال والابنورمال ستراكشر. فعندنا اشياء ليجن اور يعني ستراكشر ابير بلاك كومبوز T1 and T2 مثلا زي ايش؟ زي الكورتيكال بون لانه فيه كالسيوم او الماتيور فايبرس تيشو اللي مثلا تندون او الكالسيفيكيشن سواء كان فيزيولوجيكال باثولوجيكال. any of these appear black on both يعني high or low signal on both T1 and T2. نعرف دي الاشياء اللي تكون شنو black on both. and also air in the lung air in the sinus also appear black on both T1 and T2. فمثلا هنا عندنا الاير this air in the sinuses appear black on both T1 and T2. this is you know air in the sinuses. The skull bone appears black on both T1 and T2. The cortical bone appear black on both T1 and T2. طيب في اشياء بتظهر لنا high in both T1 and T2 زي subacute blood. Subacute blood appears high in T1 زي دي. This is subacute blood. ليش؟ لأنه appear hyper intense in T1 and T2. This is T2. لاحظ CSF and this is T1. The subacute blood appear hyper intense in both T1 and T2. الأشياء اللي بتظهر لنا of high signal in T1 and of low signal in T2. لكن لاحظ low signal not totally low signal. الفات بيكون لنا high signal in T1 لكن in T2 بيكون يعني not totally black. بيكون شنو؟ يعني هو ممكن نقول عليه high signal لكن less than in T1. This is شنو fat. أبير شنو؟ يعني أكيد بيكونوا of high signal in both لكن more in T1 than in T2. the fluid طبعا دي الأسهل واحدة وأهم واحدة اللي هي fluid أبير of low signal in T1 and high signal in T2. Any fluid CSF, plurifugal ascites, edema, any fluid anywhere بيكون high intense in T1 and hyperintense in T2 زي مثلا الأكيوس fluid in the eye globe hypointense in T1 hyperintense in T2 أو إذا عندنا مثلا ال CSF hypointense in T1 and hyperintense or high signal in T2. Uh, this is axial T2 ليش؟ لأنه CSF appear white or hyperintense. This is also T2 the fluid this fluid and this fluid appear hyper intense. This is axial and this is sagittal MRI. Coronal, this is coronal T1 لاحظ انه the CSF appear black and the air appear black. إذا عملنا T2 CSF هيكون bright but the air appear black on all you know sequences. So this is a uh, this is a nasopharynx, so this is a sphenoid sinus. الايه لاحظوا ليه كله black. And this is the pituitary, this is a pituitary gland, and this is the infundibulum or pituitary stalk, and this is the optic nerve. Please look to this anatomy. إذا عندنا we are going to discuss the pituitary gland abnormality or tumor. This is the pituitary gland, and this is the pituitary stalk or the infundibulum, and this is the optic chiasm, and this is the internal carotid artery اللي هي right and left one. Look to this anatomy because in the pituitary tumor it affects this area. Brain stem anatomy عارفين انه عندنا 3 part the midbrain and the bones and the medulla oblongata. Bones posterior to the bones there is a fourth ventricle and this is cerebellum. The fourth ventricle located between the cerebellum and the bones, and this is the spinal cord, and this is the corpus callosum, and this is the brain tissue frontal and occipital and parietal, and this is the sphenoid sinuses and the pituitary area and frontal sinuses, and this is the fourth ventricle in this axial T2, and this is temporal lobe. This is temporal lobe. But this is the anatomy of the brain, and also this is MRA اللي هي magnetic resonance angiography اللي هي shows شنو the circle of Wills اللي اتكلمنا عنها اللي هي عندنا two vertebral arteries joining to form what to basilar artery زي ما اتفقنا بيدينا شنو posterior cerebral artery. عندنا internal carotid بيدينا medial cerebral artery and medial cerebral artery and anterior cerebral artery connected by anterior communicating artery, and the posterior cerebral artery connect to the internal carotid artery by the posterior cerebral artery. But this is a circle of Wills by MRA. زي ما اتفقنا انه ال MRA technique may be done without contrast. يعني it shows this hyperintense vessel without contrast. But this is MRA. كده خلصنا imaging investigation and techniques. Now we are going to talk about some pathologies. We start with brain disorders such as infarction and hemorrhage. But infarction and hemorrhage, inshallah, will be covered in the lecture of the CT emergency. So in this session, inshallah, we are going to talk briefly about the infarction and hemorrhage. Infarction occurs when there is a ischemia, and it can be ended by the necrosis and death of the brain tissue due to obstruction of the blood flow. And the causes of the brain disorder may be traumatic or thrombosis. The hemorrhage can be occurs in the brain parenchyma by rupture of the blood vessels. There are many causes of hemorrhage, such as hypertension or trauma or rupture aneurysm or arteriovenous malformation. All these may cause hemorrhage, intracerebral hemorrhage. But this is brain and skull or head CT demonstrate this hypodensity. This hypodensity is the infarction, and also there is a small infarction in this area, small lacunar infarction. Lacunar infarction is very small infarction. إذا this is infarction. إن شاء الله الكلام ده كله هنتكلم عنه in details in the next on the CT in emergency, in the brain emergency. This is also hemorrhage. This is intracerebral hemorrhage which appear hyperdense, and this is also intracerebral hemorrhage or hematoma also appear hyperdense. هنا عندنا midline shift. تتذكروا midline shift مهمة جدا. الماس افكت، ماس افكت اللي هي midline shift أو compression of the midline structure أو phasement of the cortical cell site. فthis is a CT without contrast demonstrates the hyperdense hematoma. طيب بس ال MRI هل هي عندها role in the ischemic stroke؟ عندنا سيكونس اسمها diffusion weighted imaging. دي أهم سيكونس for early detection of hyperacute infarction. يعني acute within minutes can be detected by MRI. لأنه لما نجي discuss the infarction هتلقوا إنه مثلا in the early stage CT show nothing. يعني ممكن البيشنت عنده infarction لكن CT appear normal. فلذلك إنه this diffusion weighted imaging is the most sensitive method for early detection of infarction within minutes can demonstrate. فدي مثلا MRI diffusion weighted image. البيشنت ده كان عملنا له CT حتكون normal, no evidence of infarction, لكن you can see there is a hyper intensity at this area. فthis is a diffusion weighted image. فتتذكر this مهمة جدا. this diffusion weighted image should be requested for highly suspected infarction, cerebral infarction in acute phase or hyperacute, very sensitive to diffuse this infarction. The next condition is Dandy-Walker malformation, which is a congenital anomaly characterized by absent cerebellar vermis. Cerebellar vermis absent of the cerebellar vermis. This is normal cerebellar vermis. It is absent in this one with large posterior fossa cyst. طبعا عندنا this cystic lesion in the posterior fossa. This is a cystic lesion, large posterior fossa cyst. This cyst connected to the fourth ventricle. ده هي الفورث ventricle زي ما شفناه. This cyst is connected to the fourth ventricle. And the third ventricles and the lateral ventricle also dilated. إذا this is a posterior fossa cyst. دي posterior fossa cyst. أو عندنا absence of the cerebellar vermis ما موجود هنا. لذلك this posterior fossa cyst connected to the fourth ventricle. الحين connected here. Connected to the fourth ventricle. Other ventricle اللي هي third ventricle and the lateral ventricles اللي هي the temporal horn والfrontal horn also dilated. But this is features of Dandy-Walker malformation. Lateral and third ventricle dilated with posterior fossa cyst connected to the fourth ventricle and absence of the cerebellar vermis. This is a Dandy-Walker malformation. Other congenital anomalies is the genesis of corpus callosum زي ما وضحنا لكم قبل. This is the corpus callosum يكون in the mid in the mid brain. This is in the mid sagittal. This is corpus callosum. It will be absent in some patients. A genesis of called A genesis of corpus callosum. Here there is no corpus callosum. This is the corpus callosum. In this sagittal MRI T1 there is no corpus callosum. And this is the axial MRI for the patient with A genesis of corpus callosum. لاحظين انه شنو the shape of the ventricle. لو مذكرين الفنتريكل هو الشيب ما كان كده، ما في صورة. اللاترال فنتريكل بودي المفترض يكون دايديل كده. This is the lateral ventricle. لكن here they are separated and parallel to each other. فدي الساين دي بسموها شنو؟ racing car sign. فدي كأنها دي الريسنج كار sign. This is the wheel and this wheel. This is the wheel, anterior wheel, posterior wheel. فتشبه لنا شنو racing car sign. The racing car sign is the sign of a genesis of corpus callosum that's seen in the axial MRI brain. What is racing car sign? Is the parallel configuration of the lateral ventricle. Lateral ventricle become parallel to each other. But this is sign of agenesis of corpus callosum. لكن corpus callosum هي normal، لكن هنا absent this corpus callosum. To explain the brain tumors عندنا all brain tumors تقريبا كلايومس form 1/3 of this brain tumor, and the metastasis form 1/3, and the other 1/3 is due to non-glial tumor. طيب to differentiate to the diagnosed brain tumor أهم شيء the clinical data. أنا دائما بركز على clinical data، أنا مهم إنك to read or to correlate and connect between the clinical data and the radiological finding. خاصة في البون تيومرز والبرين تيومر الايج والكلينيكال داتا very important. هي مهمة لكل لكن in the brain tumor يعني help us يعني to differentiate between the tumor. So look to the patient age and the location. Is it intraaxial or extraaxial? And is it supratentorial or infratentorial? And then the lesion itself, يعني how it appears, is it rounded, is it, and the pattern of enhancement and the other associated features. يعني ممكن يكون في edema or not, and if there is a destruction of the adjacent or sclerosis of adjacent bone. فإذا have to differentiate to diagnose brain tumor, you look to the to clinical data and then connect the clinical data with the finding. فزي ما قلنا احنا التيومرز either intraaxial or extraaxial or supratentorial and infratentorial. نقول infratentorial اللي هي below the tentorium, below the tentorium. This is the intratentorium region and this is the supratentorial region. طيب the common tumors in the brain tumor primary ممكن تكون glioma or meningioma or germ cell tumor or pituitary tumors or binary region tumor, or ممكن تكون metastatic brain tumor اللي هي secondary or metastatic. طيب نتكلم نديكم how to report the brain tumors. يعني لما نلقى tumor in the or lesion tumor in the brain on CT or MRI, you have to look to the tumor. أول شوف الليجن، شوف الاوتلاين بتاعتها is it well defined or not or ill defined, and the shape of the lesion, is it oval, is it rounded, is it what is the shape of this lesion, and the side which is seen in the frontal, temporal, parietal, infratentorial, extratentorial, intraaxial, extraaxial. طبعا السايز measure عندنا بالماشين CT can measure the size of the lesion, and enhancement is the lesion is enhanced by contrast or not, and if there is edema, this is the edema, surrounding edema, this is the edema, hypodensity, this is edema, and the effect is there is a mass effect اللي هي midline shift or compression of the midline structure or effacement of this cell site, and also you have to comment on the normal finding. يعني if there is a hemorrhage, no hemorrhage, the hemorrhage peak extension في other side. So this is the general talk about how to report the brain tumor. فمثلا دي عندنا الليجن دي طبعا المفروض نشوفها قبل الكونتراست، الان دي هي with contrast. قبل الكونتراست المفروض to comment, you have to comment about the definition يعني قبل الكونتراست. فمثلا دي كانت مثلا there is a well defined rounded or oval shape frontoparietal lesion measuring مثلا 2 by 5 centimeter with homogeneous enhancement with surrounding edema. This is edema. نعلق على الفنتريكلز يعني نشوف هل في hydrocephalus or not. الادجيسنت ستراكشر مثلا في sclerosis of the adjacent bone or not, في hemorrhage, no hemorrhage. But this is a general talk about how to describe the lesion. نتكلم بعد الجزء الجاي ده كله more practical. فنتكلم عن أول شيء عن الانهانسنج. هنتكلم عن how the lesion will be enhanced. زي ما اتفقنا إنه عندنا homogeneous enhanced and heterogeneous and ring and serpiginous. serpiginous ده عنده one depression arteriovenous malformation. الآن حنتكلم in details with on the peripheral enhancement mainly briefly about homogeneous enhancement. One of the differential diagnoses of peripheral enhancement is glioma. Glioma, this tumor arises from 3 different types of cells. It could be astrocytoma or oligodendrocytoma or ependymoma. This glioma usually shows peripheral enhancement. Peripheral enhancement. This is a peripheral enhancement. Peripheral enhancement. A CT glioma typically appears as solitary lesion like this. This is a lesion with irregular and low attenuation center with massive effect. يعني في compression of the lateral ventricle and midline shift with peripheral enhancement. Usually show peripheral enhancement. Also an MRI. فمثلا عندنا two gliomas يسموها butterfly glioma. عندنا this is glioma and this is other one glioma. اي واحده فوقهم shows peripheral enhancement. peripheral enhancement اهم شيء انه عندنا this is differential diagnosis of glioma. فهي the CT without contrast lesion with appear hypodense. With contrast it shows peripheral enhancement. Contrast seen in the periphery of the lesion. Also, this is a MRI T1 with contrast. You can see there is a enhancement periphery or peripheral enhancement or ring enhancement. And this lesion compressing the lateral ventricle. قلنا بسموها butterfly glioma لأنه عندنا two gliomas الآن يسموها bilateral glioma. فدي butterfly glioma. نتكلم عن pituitary tumor. pituitary tumor either macro or micro adenoma. إذا عندنا adenoma in the pituitary بنسميها macro adenoma if it is more than 10 cm يعني 10 mm. And if it is less than 10 mm it's called micro adenoma. طيب how to investigate patient with pituitary adenoma? MRI with contrast, with IV contrast is the gold standard. To diagnose pituitary gland, the best and the gold standard image technique is MRI with contrast. أهم شيء with contrast, not without contrast. متى نعمل this pituitary gland? This is a protocol MRI with contrast. This is the first line diagnostic modality for suspected adenoma, pituitary adenoma. If you suspected adenoma patient with blurring of vision or deterioration of vision or hyperprolactinemia عنده مثلا suspected pituitary adenoma, this is the first line diagnostic modality. Also, it could be done for post-surgical surveillance after resection pituitary mass. يعني إذا to assess زي ما اتكلمنا قبل إنه MRI with contrast done for assessment of the recurrence of the tumor. فمثلا this also done for after resection of pituitary mass you have to do MRI with contrast. طيب pituitary tumor أكيد حتكون في الاريا of intracellular mass. It is intracellular mass. يلا نشوف الساينس بتاعتها حتشوف إيش in the MRI. أول شيء حيكون عندنا compression of adjacent structure. طبعا حتشوف الليجن أو البيتيوتري gland lesion with compression of adjacent structure اللي هي اتكلمنا عنها قبل الأوبتيك نيرف والinternal carotid artery والcavernous sinus in general. And sometimes you can see hemorrhage or necrosis within the pituitary adenoma. Necrosis or hemorrhage. إذن دي how to describe the pituitary adenoma. هنوضح الكلام ده in the image. طيب CT with contrast هل مفيدة لنا أو بنعملها متى؟ He is the second line diagnostic modality. The first line is the MRI with contrast. And also in the planning of transsphenoidal hypophysiectomy ممكن نعمل CT عشان توري يعني to assess the bone before this technique. لكن أهم شيء إنه MRI with contrast ونعرف how this tumor appear on the MRI. So this is MRI coronal T1 with contrast and this is sagittal T1 with contrast. You can look and see this is a sphenoid sinus and this is the pituitary gland. There is a lesion يعني pituitary gland أصلا ما بتكون كبيرة كده. فالآن there is a macro adenoma macro adenoma in the intracellular region. لاحظ عامله شنو compression of the شنو optic nerve. لو رجعت للنورمال pituitary gland اللي وضحنا لكم دي، this is the optic jazz compressed by this tumor, and this is the internal carotid artery يعني mildly شنو indented by this pituitary macroadenoma. And also this is a sagittal MRI T1 with contrast. You can see this tumor occupying the intracellular region which compresses optic child. And this is CT with contrast. You can see this is the intracellular lesion اللي هي pituitary adenoma. This internal carotid artery. This is CT. After contrast demonstrate how this pituitary adenoma shows enhancement after contrast. Shows enhancement. This is a pituitary adenoma, macroadenoma. طيب in the area of the cellular and supracellular area عندنا craniopharyngioma, one of the differential diagnoses. Craniopharyngioma tumor arising in the supracellular region and it can extend into the intracellular region. عشان كده بيكون في difficulty in differentiation between the pituitary adenoma and craniopharyngioma لأن هي starting in the supracellular لكن can be extend to intracellular region يعني area of the pituitary gland. Clinically this craniopharyngioma عندها bimodal distribution, can be occurred in the young people or patient and in the elderly. يعني it can be commonly seen in the patient between 5 to 14 years, and also it can be seen in patient between 50 to 75 years. كيف سموها bimodal distribution. عندها distribution in two groups of patients. Here is the most common childhood supratentorial tumor. It is not infratentorial. طبعا occurs in the supratentorial region. But this is CT without contrast and this is CT with contrast. You can see this is a lesion. لاحظ ان الليجن دي شنو عندها cystic solid component وفيها calcification as the area of the supracellular region. After contrast it shows heterogeneous enhancement. لاحظ انه في مناطق ما شارت not enhancement with contrast اللي هي بالذات المنطقه اللي فيها cyst فيها calcification. But this is craniopharyngioma, supracellular calcified cystic lesion with lobulated margin and with heterogeneous enhancement. And this is a MRI T1 with contrast. You can see there is a cystic and solid component of this lesion in the cellular and supracellular region with لاحظوا solid part enhancing with contrast. But this is craniopharyngioma. طيب نتكلم عن most important benign condition in the tumor in the head اللي هي meningioma. Meningioma is more common especially in female. More common in female than in male and common after 40 years. It is more vascular and enhanced with contrast. It shows strong or homogeneous and strong enhancement with contrast. دي أهم ما يميز this meningioma. This patient with meningioma may be asymptomatic, may be discovered incidentally, this meningioma. فالآن دايرين حد يكلمنا عن how this meningioma appear. طبعا هي موضحة هنا لكن before reading دايرين واحد try to describe this appearance of meningioma. يعني this is for the one patient and this for the other patient. This is one patient and this is the second patient. This is أكيد واضح عليكم this is pre-contrast and this is the after contrast. How to describe this lesion زي ما تكلمنا عن description, how to report or interpret this lesion. Yes, any volunteer? Let's try to describe زي ما اتكلمنا السايز والسايز كذا والاشياء اللي اتكلمنا عنها. Yes, try to comment. Okay. There is a right frontal rounded lesion, uh, hyperdense lesion with um, homogeneous enhancement and shows midline shift and perifocal brain edema. This is edema. Reason this is a lesion before contrast, rounded, well defined in the right frontal region with homogeneous enhancement, strong enhancement, homogeneously better. This is perifocal brain edema. This is edema. Hypodensity. This is edema with midline shift. And this is also meningioma demonstrate the same pattern. This is CT demonstrate, this is CT brain, and this is CT brain bone window. You can see this, the sclerosis, bone sclerosis, the bone thick adjacent to this, the meningioma compared to the bone in the other side and the other region. The bone is thick. إذا نعرف المينينجيوما how the meningioma appear on MRI and CT. On MRI which is the imaging modality of choice for diagnosing meningioma. The features of meningioma on MRI, the meningioma appear rounded, sharp, demarcated, specific lesion with هي طبعا كسترا axial lesion. لما اقول كسترا axial lesion معناتها not within the cerebral parenchyma. فعندنا الانترا كسرة axial and intra-axial lesion. Meningioma starting from the meninges. So it is an extra-axial tumor. On MRI, the meningioma on MRI T1 appear iso-intense or hypo-intense. Iso or hypo-intense to the normal brain parenchyma, and it is iso or hyper-intense in T2. طيب لما نعطي البيشنت contrast هي shows significant homogeneous enhancement of the lesion يعني and with some pairs or spoke wheel appearance. عندها الشيب بتاعها بيكون يشبه شنو؟ some pairs يعني قرص الشمس أو السبوك wheel appearance. and عندنا sign مهمة اسمها dural tail seen after اللي هي due to thickening of the meninges. بيكون عندنا thickening with enhancing meninges بتسميها dural tail. CT زي ما شفنا الصورة اللي قبل شوية CT scan performed to investigate unexplained headache or seizure ولذلك هي شنو incidentally finding this meningioma. البيشنت بيجي غالبا ب headache or seizure فبنعمل CT we discover إنه this patient have a meningioma. فالfindings on CT زي ما شفنا كانت hyperdense زي دي hyperdense أحيانا بتكون isodense بتكون hyperdense إذا كان في calcified لأن meningioma can show calcification. Well-defined extra-axial mass with calcification. This is MRI T1 زي ما قلنا هي بتكون rounded حتى الآن هي hypo-intense and hyper-intense in T2. This is T1 and T2 with homogeneous enhancement and dural tail. This is dural tail. هي thicken and enhancing dural. This is dural tail. مهمة جدا الصاين. So this is ألاحظ إنه في midline shift and اللي هي mass effect, midline shift and compression of the lateral ventricle, and there is edema. Edema طبعا fluid بتكون hypo-intense in T1 and hyper-intense in T2. So this is the edema cell, perifocal brain edema. Aneurysm اللي هي dilated vessels. One of the differential diagnosis of homogeneous enhancement is aneurysm. So this is a aneurysmal dilatation of the internal carotid artery bilaterally, and this internal carotid artery shows homogeneous enhancement, and this is the basilar artery aneurysm, which show also homogeneous enhancement. So the other differential diagnosis of homogeneous enhancement is aneurysm. إذا عندنا aneurysm and the meningioma. الاكوستيك نيوروما او الاكوستيك شوانوما او فيستيبيولار شوانوما زي ما شفنا الصوره الجبال اللي كانت هي شنو وضحت لنا ال before and after contrast difference between MRI before contrast and after contrast. The contrast MRI is the imaging modality of choice for diagnosis acoustic neuroma. And CT with and without contrast may be done as an alternative imaging technique. Like if the MRI is available, MRI with contrast is the investigation of choice. And this meningioma, this is the acoustic neuroma shows, enhancing lesion. لاحظ انه enhancing in T1 with contrast, enhancing lesion. And this lesion extended into the internal auditory canal. So this internal auditory canal extension are also extended into the cerebellopontine angle اللي هي angle between the bones and the cerebellum. So this is so the vestibular schwannoma or acoustic neuroma characterized by a lesion in the cerebellopontine angle extending to the internal auditory canal. لانه هنا في differential diagnosis من انجيوما كان بي سين هنا لكن ما عندها extension into the internal auditory canal. If there is a bilateral acoustic neuroma زي دي, this is the has strongest association with neurofibromatosis type 2. يعني the patient عنده bilateral acoustic neuroma, this is commonly associated with neurofibromatosis type 2. This is CT. Without contrast, you can see this calcification in the basal ganglia. But this is 36-year-old patient present with headache and acute confusion for many months with upper extremity tumors. But this CT demonstrates this calcification in the area of the basal ganglia, the head of the cardiac nucleus and the deformed nucleus and the thalami. But there are many differential diagnoses of basal ganglia calcification. The commonest one is hyperparathyroidism, but there is other differential diagnosis. So hyperparathyroidism characterized by basal ganglia calcification. So this is the calcification in the basal ganglia. اتكلمنا عن الجلايوما كان كوز قلنا شنو ring enhancing lesion. عندنا other definition of ring enhancing lesion is tuberculosis. Tuberculosis also is can present with ring enhancing lesion. But this is MRI T1 with contrast axial, and this is MRI T1 with contrast coronal. You can see there are multiple lesions. لكن try to look to this pattern of enhancement. لاحظ انه حصل peripheral enhancement. The center not enhancing. لاحظ in the center there is no contrast. The contrast seen in the periphery. But this is a multiple tuberculosis with one of the differential diagnosis of ring or peripheral enhancement. The other differential diagnosis of peripheral enhancement is metastasis, metastatic brain tumor, also characterized by peripheral enhancement. peripheral enhancement. فزي ما انتم عارفين انه الميتاستاسيس usually is typically multiple. يعني احنا دائما لما نلقى solitary lesion ما بنفكر في الميتاستاسيس، لكن لما نلقى multiple we put the metastatic lesion on the top. فthis metastatic brain tumor إذا كانت solitary or multiple usually بتكون well circumscribed tumors usually seen as the area of the white matter interface, white gray matter interface or junction. يعني هي دائما تكون ظاهرة لنا as the area of the most common site of the metastasis is white gray white matter interface or gray white matter junction. If the metastatic lesion is small, الانهاكمنت بيكون homogeneous. كل الليجن takes the contrast. لكن if it is large it shows ring enhancement. يعني هي بتكون ring enhancement if it is large tumor، لكن إذا كانت small بتكون homogeneous enhancement. عندنا معلومة مهمة إنه إذا كان عندنا posterior fossa tumor in the adult زي دي posterior fossa tumor especially if it is ring enhancing, this should be considered as metastatic lesion until proven otherwise. Any posterior fossa tumor in adult should be in the parenchymal lesion should be considered as metastatic tumor until proven otherwise. إذا عرفنا 3 differential diagnosis of brain enhancing lesion: gliomas, tuberculomas, and metastasis. The first one is cerebral abscess. The cerebral abscess characterized by pus in the center. This is the pus in the center of the abscess. طبعا لأنه fluid عشان كده on CT appear of low density of fluid density. With contrast it shows peripheral enhancement. فدي CT إذا كان جبنا لكم الصورة اللي قبل الكونتراست هتلقى الليجن سوداء of low density due to presence of pus. After contrast it shows ring enhancing. هي ايش دي ايديما. This is perifocal brain edema. كل الناحية دي ايديما. And also on MRI, this is MRI shows this is MRI T1 with contrast. This is T1 with contrast. The lesion shows peripheral enhancement. ولاحظ برضه عندنا perifocal brain edema. Perifocal brain edema. So this is a cerebral abscess. Anyone to comment on this image? This one or this one?
هذه MRI
MRI
فيها هايبو انتنسيتي
T1
ليجن.
or please T1 or T2.
هذه T2. لا
ممكن تكون نظر. إذا ما T1 ولا T2 ممكن تكون إيش؟
هذا فيها كونتراست المفروض.
إذا كانت فيها كونتراست معناتها إيش؟
معناها نسيت. T1.
T1 أي كونتراست T1 with contrast. T1 with contrast. What is your name? Who are you? Anas. Thank you, Anas. But this is T1 with contrast. Yes. How to describe this lesion?
فيها ليجن فيه هايبو انتنسيتي لأن فيها بص
Yes.
أو مكون من بص، فغالبا راح يكون اللي قبل شوي cerebral abscess.
طيب how about the better of enhancement?
نقول يعني رينج
يعني
انهانسمنت
rank enhancement. يعني هو
أو
البريفرال
بريفرال.
تيجي تكون في البريفري كده الانهانسمنت الكونتراست شايف الابيض دي احنا زي رينج enhancement. If there is any edema.
يس في
Yes.
إديمة حولها هايبو انتنسيتي برضه.
Yes, hypotension is a brain edema. Thank you. Also, this is CT. Thank you, Anas. So this is the lesion shows peripheral enhancement and then multiple abscesses. This is abscess and this abscess with peripheral enhancement and perifocal brain edema. طبعا البيشنت بيكون عنده فيفر وغالبا بيكون عنده history of ear discharge, especially في children, بيكون as a complication of otitis media, chronic or otitis media, then develop this brain abscess. hydrocephalus باقي لنا بس hydrocephalus and brain atrophy. الاثنين بيشبهوا بعض. hydrocephalus is the dilated ventricles. This hydrocephalus may be بنقسمها ل communicating and non-communicating. هنيجي نوضح الكلام ده كيف. طيب to diagnose hydrocephalus إذا كان عندنا الانفانت ممكن نعمل لهم transcranial ultrasound. If this hydrocephalus is suspected in infant, especially less than 6 months, we have to do transcranial ultrasound through the anterior fontanelle زي ما اتكلمنا في البداية. This ultrasound can demonstrate enlarged ventricle. هنشوف الفنتريكل enlarged, dilated. طيب MRI or CT done for the older infant or for the adult. لأنه before 6 months ممكن نعمل البروب can be put on the open anterior fontanelle. After 6 months, usually we can investigate hydrocephalus with CT or MRI and also in the adult. MRI is referred to CT on in infant. طيب how to diagnose this hydrocephalus, acute hydrocephalus. أول شيء هي by definition هي dilated ventricles، فلذلك حيكون عندنا large ventricles filled with CSF. طيب طبعا فعندنا communicating hydrocephalus and non-communicating. Communicating hydrocephalus when communicating hydrocephalus there is a dilated all ventricles. الفنتريكلز كلها تكون dilated. لكن ال non communicating بيكون ventricles above or upstream اللي هي above the level of obstruction بتكون dilated. لكن the lower part is not dilated. يعني مثلا إذا عندنا هنا إذا عندنا hydrocephalus involving all the ventricles دي بنسميها communicating لأنه كلها بتكون متصلة مع بعض. كل الفنتريكلز dilated بنسميها communicating hydrocephalus. لكن if the مثلا third lateral ventricles and third ventricles are dilated but the third one the first one is not dilated معناتها عندنا دي بيسموها non communicating لأنه obstruction above the first ventricle دي بيسموها non communicating hydrocephalus. So the hydrocephalus occurs in the ventricles upstream of the obstruction above the level of obstruction but the lower ones are not dilated. فاذا دي شنو how to diagnose شنو hydrocephalus. طيب عندنا الصاين مهمه جدا انه نعرف انه hydrocephalus earlier اللي هو لما يكون التمبرال هورن dilated more than 2 ملم دي early signs of hydrocephalus. يعني ممكن اللاترال ventricle والسير ventricles البادي والانتيريور هورن والبوستيريور هورنز والاذر بارت ما تكون dilated. The first part usually dilated is the temporal horn. Temporal horns can be dilated earlier. This is early sign of hydrocephalus. Also, there is other sign اللي هي شنو Mickey Mouse ventricles. Mickey Mouse ventricles is characterized by large lateral and third ventricle. Enlarged lateral and third ventricle. And also other sign of the hydrocephalus is sulcal enlargement. هنشوف الكلام ده in the image. فهيدروكيفالوس له cause elevated intracranial pressure. البيشنت ممكن يجي ب headache, nausea and or vomiting. ده البرزنتيشن كلينيكال برزنتيشن. طيب هنعمل ايمي اذا كان طبعا يانج هنعمل له شنو الترا ساوند. اذا كان مثلا before 6 months. اذا كان more than 6 months MRI is preferred او ممكن نعمل CT. This is CT for the head demonstrate how this lateral ventricle is dilated. The lateral body of lateral ventricles both body are dilated. Also هنا the occipital horn or posterior horns are dilated and the third ventricle is dilated and the anterior horn also dilated. Also this is hydrocephalus and this is the fourth ventricle and temporal horn. The temporal horn dilated more than 2 millimeters. This is indicating this is early hydrocephalus. All these are hydrocephalus. طيب in this one there is the grossly enlarged body of the lateral ventricle right and left and also this is the enlarged ventricle اللي هي شنو anterior horn and posterior horn of lateral ventricle and this is the dilated شنو anterior horn and the third ventricle زي ما سماها قلنا شنو ميكي ماوس. this is the Mickey Mouse sign اللي هي Mickey Mouse sign اللي هي due to شنو enlargement of the frontal hair horn and the third ventricle. but this is the Mickey Mouse appearance. طيب إذا كان if CT or MRI demonstrate dilated for anterior horns of lateral ventricle and third ventricles and temporal horn, but the fourth ventricle is not. Fourth ventricle is not. Is this communicating and not communicating hydrocephalus?
None.
Non-communicating. So what is the level of obstruction? What do you think the level of obstruction? Is it above or below the first ventricle?
Above.
Above. So between the above the first ventricle. طيب above or below the third ventricle?
لا هذه يمكن هذه بتكون below.
Yes, below. So it is between the third ventricle and fourth ventricle. So what is this structure is located in this area? ايش what's which structure connected between the third ventricle and fourth ventricle? Which duct?
Aqueduct.
Yes,
L'aqueduct.
aqueduct. This also the level of structure is the cerebral aqueduct. This aqueduct يعني معناتها the level of structure as the cerebral aqueduct. طيب الآن دي آخر سلايد عن الايجينج اللي هي patient with elderly, how the CT or MRI appear on the elderly. Aging can affect the appearance of of the brain on CT and MRI. There are many changes can be seen on CT and MRI in elderly, but these changes uh, not correlate with the clinical state of the patient. يعني مثلا كان لقينا ان في brain atrophy يعني severe brain atrophy, this does not mean in this patient عنده a strong مثلا memory disturbances or not. There is no correlation between these these findings and the patient clinical presentation. طيب the science or the supportive findings of aging process on MRI include enlarged ventricles. لاحظ انه الفنتريكلز هنا enlarged كأنها هيدروكيفالوس زي دي، كأنها هيدروكيفالوس لكن in addition to the enlarged ventricle also there is prominent cerebral sulcide. السلسايد دي اللي هي فيها CSF also prominent. السلسايد prominent لكن in the هنا ما prominent السلسايد. This is different. So there is a enlarged ventriculomegaly with prominent sulcide سميها hydrocephalus X vacuum and narrowing of the gyri. لاحظ الجيراي اللي هي دي الجيرس حصل لها شنو؟ كأنها atrophied. This is a sign of of aging process in the اللي هو brain atrophy يعني اللي هي is the sign of Alzheimer disease. But this is MRI T2. Also you can see there is a prominent sulci يعني CSF بقى كثير في الصلصاي دي with atrophy, especially the temporal lobe here atrophied. والcistern there is a many CSF in the cistern and cell side. So this is brain atrophy which could be due to Alzheimer disease or sinusitis and all. Sinusitis is a brief talk about the sinusitis. اتكلمنا عن sinuses on CT on this is a normal maxillary sinuses. فإذا كان البيشنت عنده sinusitis what is the features of CT on sinusitis on CT? CT maxillofacial with or without contrast should be done for patient with suspected sinusitis. What are the signs that can be demonstrated on CT for the paranasal sinuses؟ أحيانا نلقى شنو؟ rhinosinusitis يعني evidence of sinusitis or rhinitis or rhinosinusitis الاثنين مع بعض اللي هي evident by what? Ossification of the sinuses according to the affected sinus مثلا maxillary or ethmoid sinuses and mucosal thickening. هنوضح لكم الآن كل الأشياء دي. This is normal الآن. This is a normal maxillary antrum. لكن إذا كان ossified زي دي ossified زي دي or mucosal thickening زي دي thickening أو thickening زي دي or the nasal antrum. This is a sign of rhinosinusitis or air fluid levels. Also air fluid levels زي دي مثلا زي اكس راي احيانا بنشوفها in the CT بيكون عندنا fluid levels. All these are signs of the sinusitis and also CT can demonstrate the underlying cause of the acute sinusitis. يعني usually البيشنت يكون عنده sinusitis ممكن يكون عنده an underlying cause for this sinusitis. ممكن يكون عندهم anatomic abnormalities. مثلا ال النازل بون يكون tilted or يعني not in the midline، أو يكون عندنا many anatomical variant can be disposed to sinusitis, or presence of polyposis also can be predisposing factor or underlying cause of sinusitis. ممكن نعمل ام ار اي، لكن دائما احنا اهم شيء عندنا سي تي هي ذا بيست. ام ار اي with or without contrast can be used for assessment of the uh, sinuses, and it also can help us in assessment of the extension of the sinusitis or sinus disease into the orbit or intracranial. طبعا اكس راي زمان كان بيتعمل طبعا، لكن ناو يعني بيفور السي تي كان ما في طريقه اللي يدعم له الاكس راي دي، اللي هي عندنا فيو معين بنتعامل بالعمليات توضح لنا شنو الساينس. فدي مثلا ساينوسايتس اكيوت ساينوسايتس عندنا شنو اير فلويد ليفل اور اوبسيفايد شنو الماكسيلاري ساينس. لكن with presence of CT يعني this X-ray is not recommended for assessment of the sinusitis because it is not sensitive and not specifically diagnosed sinusitis. Although it may show air fluid level زي دي. But this is paranasal sinus plain X-ray demonstrates air fluid level. This is air fluid level. لما نلقى خط فاصل بين التو density air fluid بنسميه air fluid level in the right maxillary sinus. But this is the typical features of acute sinusitis. This is طبعا قارن بين normal دي CT coronal or paranasal sinuses and this one. فهنا there is a الإزيمويد ساينسز لاحظوا اوبسيفايد، والماكسيلري ساينسز also اوبسيفايد. there is a bluvoid soft tissue density lesion, but this is chronic rhinosinusitis. And also this is acute sinusitis ليه؟ لأن حصل لنا ossification of the right maxillary sinuses. The left one is not ossified. This is normal. لكن عندنا في عندنا soft tissue، عندنا thickening soft tissue thickening is small هنا، لكن the right one and the also the nasal terminate is occupied by this ossified. This is acute sinusitis. Do you have any question? Do you need any explanation for any slide? Yes. Any question? Don't hesitate to ask.
Thank you, doctor.
Thank you. السلام عليكم.
Thank you, doctor.